thoughts don't go away when you walk through the door of the hospital and go home. They are always with you, and being able to deal with that is a really important part of being a doctor.
Once I get in the car, work's work and here, and home's home.
Our job is to help people through a situation and help them cope and deal with circumstances that they almost certainly have never come across before.
I'm not really quite sure what I expected when I went into this career. I think it's always very hard to look ahead, but it's been a fantastic job to be part of.
I do a lot of hand-holding, both with the families, the kids themselves, young people, and other professionals. From a family perspective, we are the key workers, so like I guess like the linchpin in their treatment and follow-up. So we're the go-to people to find out where to be signposted for other things, wherever they are in treatment, really.
I don't think the job of being a doctor can ever be a routine. You may go to work in the morning with a very set plan, but it just never really quite works out like that. And I guess that's just the nature of healthcare.
The hardest part emotionally is telling a teenage patient that they're going to die. That's one of the hardest things to do. The next hardest thing is telling the parents of a child of any age that their child is probably not going to survive and is probably going to die. Obviously, the time of diagnosis is very difficult for families, but for me it's not always the hardest thing to do, because the outlook for most children with cancer is better. 80% of children with cancer are now cured, 75% of children with brain tumours are cured. So we can be a lot more optimistic than you might think that you would be in that sort of conversation. It's just in those few rare circumstances when you have a child that presents to you with a disease that you know you're unlikely to be successful treating, or if someone's has had a relapse or a change in circumstances that mean that cure is not going to be possible, that's the hardest things then.
The people who work with me are a great source of comfort and helping to deal with that, because we all know the issues that we go through, and we are all, I think, there for each other, and I think without that it would be very difficult.
If you don't get the right work-life balance with things, if things preyed on it all the time, then you're actually less efficient. It is emotional and upsetting to have to break information to people, but we're actually here to help people, and if we become over-emotional and over-involved, then we cease to be able to offer them the help and support that they need. So it is possible to sort of step back. I find it possible to step back. Again, if things are getting very difficult and there are circumstances that happens, sometimes you need to take a break and ask a colleague to perhaps deal with something else. Or there's been occasions that I've maybe had a scheduled teaching session with medical students or something, and I've rescheduled it rather than go straight into something when you're still emotionally processing what you've just discussed.
We see families for a really long period of time, especially if they're diagnosed when they're young and they're in follow-up for many years. So we tend to be a constant in their lives, whereas some of the junior medical staff are changing fairly regularly, and maybe the nursing staff on the unit are changing regularly. So we're somebody who is fairly stable in their lives.
If we're giving some bad news to a family, so let's say we're telling them that their child's tumour has come back, or if the child is older, telling them as well, then that's really difficult. And I think that we're upset as well as the family being upset. They cry, of course they do, and that's completely normal and isn't something that we're frightened of. But actually, to an extent, we need to retain a little bit of professionalism within it, whilst at the same time sympathising and empathising with them.
It's a tremendous privilege to actually get to see patients sort of growing up and to see what happens, and to for people to let you into their lives at what are very intimate times.
I don't have a very formal affect, shall we say. And I think that means you are quite vulnerable to actually letting more of yourself out.
Children don't tell you when they're going to become unwell. Things just intervene in the middle. And integrating the research within that kind of environment is really challenging. But if people don't do that, then things don't get better for the children, and that's what's most important. I wasn't quite sure what it was that I enjoyed so much. I guess it's just so much more informal than all of the other medical specialities. Children demand that of you. You have to be able to play with them and just enjoy being with them, and the parents as well are just so fully engaged that it's just great. It's a fantastic job, and for lots of reasons, but I think it does affect us, and I think it's bound to affect us, and I think that we wouldn't be human if it didn't.